So, I have been a physical therapist for right around 17 years. Graduated in 1997 from the University of North Dakota. We were married a year before that, in 1996. She was my sugar mom for a few years. Supported me while I was going to grad school. And shortly after that, I realized that what they taught me in physical therapy school wasn't enough to treat a lot of the problems I was seeing in the population. So I went to an advanced manual therapy school called the Ola Grimsby Institute, and I did a 2-year residency through them. And they have a 2-year residency for a DPT and a Master's of Orthopedic Manual Therapy, and then they have another 2-year residency that gets you a PhD and a Doctorate of Manual Therapy. And I've done all of that, so I have a lot of school. As she said, most of my life has been in school. But that allows me to have a unique perspective on a lot of different things, and especially back and neck pain and some other things that are commonly either misdiagnosed or undertreated in the population. I want to talk to you guys about that, especially since you guys are moms. One of the things that goes haywire all the time when you have a pregnancy is you end up with this ball of 20 to 40 pounds sitting in front of you that changes your center of mass and puts a ton of pressure on your spine. And everybody gets back pain. And who had back pain when they're pregnant? Just about everybody. Who is no longer pregnant and has back pain now? Okay. There are several causes of back pain that are common. Commonly you have herniated disc. Anybody heard of a herniated disc? Okay. Degenerative joint disease or degenerative disc disease, have you heard of that? Okay, a little bit. SI joint, anybody heard of that? Okay, a little less familiar with the SI joint, we'll talk about that. And then sciatica, neural pain. Anybody talking about sciatica, heard that term? Okay. So let's talk about herniated nucleus pulposus or a herniated disc. Discs are the cushion between your spinal vertebrae. Okay, so the discs are made up of cartilage and a little bit of, gelatin substance in the middle. And the gelatin substance can leak out of the back of the disc. The disc can fail on the outside, and it can push back onto the nerves that are behind the disc. And that will give you nerve pain. It will give you pain that shoots down your leg. Now, when you have back pain, how many of you have back pain that goes past your hip into the leg? And how many of the, keep your hands up. Okay, it goes into the leg. How many of those hands does it go below the knee, into the foot? Okay, just a couple. And it's more rare for that, and it's a different problem. Typically, if it's just a disc problem, the pain is going to go into your leg, maybe to the knee. If it's a nerve problem where the nerve is actually getting pushed somewhere, it might go into your foot all the way down. And that's an important distinction because they are treated somewhat differently with those two things, and we'd have to look at that. But most of the time when you get treated for back pain, you go to a chiropractor, or you go to maybe a physical therapist. You definitely go to your doctor first, typically. People go to their doctor. And what do you get prescribed when you go to the doctor?
Ibuprofen.
You get ibuprofen, and they say, rest for 2 weeks, and come back and see me, right? Or rest for a month, and see me in a month, and see if that helps. And oftentimes with these back issues, they're somewhat time sensitive, and that's why I'm on a crusade to get people to come into care early. If you have a problem with a back pain that's in your central back, and it's radiating down your leg, or it's not radiating, it's just in your back, and it's kind of just sore and giving you a problem, but it doesn't go away in a couple of weeks, because most of the time you don't go to the doctor the day you have back pain. You've already waited 2 weeks, or you've already waited 3 weeks, and you're like, oh, no, it's just not going away. I guess I better go in and get it looked at. So it's not very helpful to say wait a month and then take some ibuprofen and go home. Not that that's necessarily wrong. They're just making sure you're not going to die. That's what the doctors do, and that's not a problem. But they should be sending you immediately to me or somebody like me, because that's where you can get a lot of help. SI joint problems. The sacroiliac joint is another common problem with moms. When you have a baby, your pelvis has to expand to accept the baby in the birth canal. Otherwise, unless you had a C-section, which is possible, then that didn't have to happen. But even if you had a C-section, you still have the hormone in your body that allows that expansion to happen. So it's sometimes even a little bit worse when you had a C-section, because the C-section doesn't allow the normal birth hormones to happen, so you don't get the release of oxytocin and some other hormones that you would get if you had a vaginal birth. So what ends up happening is the ligaments stay a little bit loose for a little longer than they would if you had a normal birth. So when you are holding said baby and trying to breastfeed the baby and trying to carry him around in a dumb car seat that makes you walk like this, I mean, oh my gosh, the design of these things. All of that, carrying 30 pounds out here and holding that all on one side, all of that causes a whole lot of stress on your joints, in your back and in your hips. And sacroiliac joint is the joint between your pelvis bone and your back. So that joint, if it's really loose after a birth and you're loading it a whole bunch on one side, very likely will slip or twist or give some other problem. And then it tends to solidify over the next 4 to 6 weeks, and it might solidify in a position that isn't normal and then cause you some dull, achy pain right in that low back right here. And it's just that pain, pain, pain. It may go down your leg, it may not, it might be right there. It's usually worse when you try to back bend. You bend backwards and you're like, ooh, that's much sharper versus forward bending. That's probably sacroiliac pain. Also something that requires a little mobilization to fix that. And we'll talk about treatment in a bit. How about neck pain and headaches? How many of you guys have headaches?
All the time.
That aren't caused by your husband. Headaches are caused by a whole lot of different things. There's several different types. There's actual migraine headaches that are really more of a vascular problem that they think, and maybe some neural inflammation. We don't really know. Actually, different migraine headaches, there's hundreds of different ones, so I'm not going to try to diagnose those. But there is also tension headaches, and tension headaches are important because they're incredibly common for people that carry things in front of them. Who does that? So when you carry something in front of you, whether it's a baby or the extra weight in your chest from having babies, it causes this posture. This posture causes a bunch of pressure in the upper neck and in the lower neck here. The muscles of your neck compensate by tightening down and cause what we call suboccipital headaches. Suboccipital, this is the occiput part of my neck. Below the occiput is what suboccipital means, and these muscles right here run the blood supply to your scalp, and what a nerve called the greater occipital nerve runs right through there, and it causes this headache that goes on over your head and eventually blows up behind your eyes, and you get this thumping pain right in your forehead, and you probably know what I'm talking about, right? Okay. The thing that ibuprofen will take care of, or Excedrin, or things like that for a period of time. But it's a postural headache. It's a headache from stress in the tension, or in the muscles up here. Therefore, ibuprofen only covers the symptoms. It's kind of like if I stuck a needle in your hip and said, take ibuprofen, it won't hurt. It won't go away until you take the needle out. That's the idea. So the extra weight in your chest, breastfeeding, that posture can be a problem. Carrying extra weight, babies in car seats, holding things in front of you, posture changes, simple fatigue. I mean, you guys, I saw it on the page up here. You said, I don't have a 9 to 5. I have a till I wake up until I close my eyes. That's kind of what you guys do. You tired, fatigue is part of it. Also, nutritional causes. Nutrition's a big part of headaches too. And you know, if you have allergies to foods, that could be an issue. If you have a lot of sugar intake and not a lot of vegetable intake, you get a lot of quickly processed sugars, you can get a sugar headache or a glycemic headache is what we call that, from the sugars hitting your bloodstream real quickly. That happens too. We can talk more about that later if you have questions. I'm going to run through this pretty quickly, and you guys can ask questions. Stress, emotional causes. I mean, if obviously stress of life, babies add expense, they add crying at night, they add stress between you and your spouse. There's a lot of things that cause headaches from that way. And then hormonal causes. You guys, when you have a baby and when you have your cycle and several other things, you go through major hormonal changes. You get an estrogen bath in your system that's like 20 times the normal estrogen level as you're resting every month. Oh, fun. You know, there are several times I'm really happy I'm a guy. We go through our cycles too, but it's not the same. But when you're pregnant, it's even worse. I mean, your first 8 weeks of pregnancy, your estrogen level doubles every 3 days. I mean, it's amazing how much you get. It's incredible. So that can cause headaches, and also medication. You can take medications that will cause headaches, including anti-inflammatories. And not including the anti-inflammatories, the biggest problem I have with them is people take them long term to get rid of a problem that's postural. Like we talked about before, that needle in the hip idea. You take ibuprofen to get rid of the headache, and then 4 hours later the headache comes back because it's not caused because you lacked ibuprofen. It's caused because you've been sitting in this posture. So it comes back, and then it comes back, and you start getting that headache back. So you take more ibuprofen, and you do that for 3 months, and then pretty soon you go, my stomach's a little sore. Ibuprofen eats up the stomach lining. It's not quite that simple, but yeah, it basically destroys the stomach lining. And if you take acetaminophen, well, that's hard on your liver. That's your Tylenol. That's tough on your liver. Not a good long-term solution to the problem. You get other issues. So what can you do about it? Back and neck pain. Most of the time, people go to chiropractic. You know, that's not a bad solution, albeit temporary. A lot of the time, it's a good fix if you have a vertebrae that's out of place or something like that. Acupuncture and massage are also very good things. Massage especially can do Britta's bone work. That's a fantastic adjunct to getting that posture better and working on the tissues that are causing the problem and actually fixing the issue. And then physical therapy. Obviously, I'm kind of an advocate of physical therapy. Strength, soft tissue mobilization. I can do mobilization in cervical high thrust mobilization like a chiropractor can do. Nutrition counseling, I can talk to you about your diet and what's possibly causing that. And generally hone in on the real problem, what's causing it, and then probably give you a good solution to the issue with physical therapy. And then that's kind of like lifestyle coaching. What are things that you can do to change that are going to help you? How do you lift your baby? How do you work with the carrier and all that? How do you avoid getting your hair cut in the car or... All right. So back in neck pain. Before I move on, I do want to take 1 or 2 questions just to move on, because I do want to talk about one more topic that's taboo in our society, because it's about incontinence. But we'll talk about that later. So back in neck pain, anybody have any questions or comments on what we've talked about so far? Crickets? Oh, there's one. Good.
So it's not a question. It's, since I go to him, well, I don't anymore, because he's prevented surgery for over here with me. Thank you very much. But tell him about core. You taught me to live with exercise.
Well, and that's the thing. I mean, when you have a disc problem or what we're talking about before, the SI problem, all those things, are generally what we call instabilities, or a category of an instability in the back. Something is moving more than it should. It's not being controlled well. So your ligament system, which is the ligaments around the spine and the disc is included in that, has failed you. So it's not working properly. Normally your back is stable by its ligaments. If the ligaments fail, well then your muscles have to take over. And you can train your muscles to stabilize your back within a range of motion. It's important that you learn to do that. So when we talk about core strength, what I talk about are 2 different types of muscles. You have your inner muscles that control the joint motion, and you have your outer muscles that move the bones. You know, it's like my bicep. I can bend the arm with my bicep. It's got a great lever arm for that. But I also have the brachialis underneath it that's really close to the joint line that controls the joint to make sure my elbow doesn't lock up when I do that. It's got good force throughout the joint range of motion. Your spine has the same mechanism. A muscle called the multifidus is deep in there and it controls the joint. But then you have your erector spinae and your obliques and your stomach and all those things that also help move the joint. It's important to coordinate those 2 muscle groups all the time to get them moving properly. So that's the big key, is working your core and stabilizing those segments that are no longer... I don't think that was the most efficient path to that scene. To stabilize those muscles is important to get the spine functioning properly, and that's what you work on a lot in physical therapy if you see me. Besides getting the joints to move right, then you have to stabilize them so they move correctly for a long time, stay moving correctly. Couple other hands I saw.
Mine doesn't really, I have a ton of back issues. I had to have a spinal fusion, so I wouldn't be paralyzed.
That's good.
But, so anyway, I had, like I said, it wasn't really, I was just wondering if you know any way to go about getting more, I've already had my 12 visits for the year, so I was going twice a week. And I'm wondering how I can go about getting more, because the insurance won't approve anymore.
Yeah, your insurance, that's the problem with insurances. Insurances are contracted between you and the insurance company as to what they'll pay for medical care.
Yeah.
As far as getting more, you can come to me and say, gosh, I need some help. Can you help me? And I'll say, sure. And you probably come to my house and I'll work on your back. But outside of that, your insurance company has a limit per year, and it will not go above that limit. Unless you have some exceptions, but if you have like a 12-visit limit per year, and it's not a pre-authorization type situation, they'll just say, yeah, that's all we're contracted to pay.
Okay, yeah,
That's
because
it.
we tried to go about, like, because my back and my neck need.
Right, try to
So
separate
we
the
tried to
two.
separate it so where my back was first, but they wouldn't approve the neck. So
Right.
I'm just seeing if there's a way to go about.
Well, there might be. My front desk is fantastic. Jessica, she goes to this church, but she's fabulous, and she will, if you call her, she totally tell you if there's anything she can do. But she'd be the one that's the expert there. So.
I'm a military wife, and I had my first baby, C-section at age 41. And so I know we need to put our health in our own hands. I didn't know the symptoms because, again, I had a C-section and my joints were all loose and everything. So our first step is to go to the primary care physician. And they told me I was wearing my clothes too tight. And in the ibuprofen, which I wear this, I'm not wearing any tight clothes. And I'm like, really? And I'm like, I always feel something, whatever. So when having a baby, because our hormones are changing, after the pregnancy hormone, we have the lactation hormone, what should we be going to a chiropractor first, a massage person to see if we're getting jointed? When should we? Because
yeah,
how long?
When to go see somebody like you.
Yeah, because then after you breastfeed, you have another hormone, you're getting back your normal hormone.
Yeah.
So, I mean...
And the hormonal changes within your first 6 weeks postpartum, so I mean, baby's 0 to 6 weeks old. A lot of that's happening during that time. I could even go up to 8 weeks probably, where things are still kind of adjusting. I won't even adjust somebody sacroiliac joint until they're 8 weeks out. I just won't do it because I might as well, not do it, because as soon as you walk out the door, it's going to be out again because it's so loose still. So about 8 weeks postpartum is about the time where things start to solidify and you'll start to stay and be able to stabilize. And like I said, I advocate chiropractic treatment as much as anything else if it's a joint problem. The problem is most of you guys' problems are going to be hypermobility. Something is moving too much, and chiropractors get the joint to move more. So it doesn't really make sense. That's not really what you need. You might need to align it and then strengthen, but then you've got to go to 2 providers for that.
Yeah.
So I figured just come to me.
Okay. So we should be doing it. Okay.
And I was going to say too, there's another few of us in here, but if you have Tractor Standard, I had no issues going to him.
Right.
Okay.
And it's
Prime.
instead, like, I don't have Prime.
Try
so,
US Family, is that what you want?
Well, I have that now.
Yeah.
But,
Yeah, and I take Tractor.
Because, like, you have to kind of just tell the physician, like, I
This is
need
what I want.
Well,
an
unfortunately,
FCF physical therapist.
depending on your physician, and their training, you may need to say, I really want physical therapy, and most of the time the physician's going to go, oh, sure, that makes sense.
Yeah.
That's not first on their mind. I don't blame physicians at all, because their family practice docs get a 2-week course during their 4 years of training, before they do their residency. They get a 2-week course about other professions. So they get about a half-hour lecture about what physical therapy is. Okay, so they're not going to be an expert, and they're not going to necessarily go, gosh, this is a physical therapy problem.
Yeah.
So then you may have to ask.
Okay.
And that's okay.
Thank you.
Yeah.
I have physical syndrome. I have physical syndrome.
Oh,
Which, so I have 5 vertebrae and 2 of them are fused, so I literally have like 4 vertebrae.
right.
And it's inoperable. I've never known what the solution is or anything else I can do.
Stabilization. I mean, the problem with that, when you have a fusion, whether it's a surgical fusion or a natural fusion or abnormal fusion, whatever you want to say, you take all the force. The spine is designed to have 5 movable segments in the lumbar spine. And if you only have 4 or 3, the force is still going to be absorbed in that spine. It's just going to be absorbed by the rest of the segments that can move. So what you need to do is make sure that those segments are as strong as possible and you're really keeping it steady. So that's where the core strength that I was talking about with Marguerite is so important, to get those muscles firing properly. And oftentimes when you have pain, especially if you've done back pain, the first thing the muscles do is guard and spasm and they don't function properly. Then they get weak. And over time, you need to wake them up, strengthen them, and then it changes your life. I blew up my L4-5 disc when I was 28 years old. I was playing golf, and golfed 3 times in 3 days. My dad was out for Thanksgiving. Sat in this big papasan chair that had my feet up like this for about 10 minutes after a golf game. I couldn't get out of it. It hurt so bad. As soon as I moved, it was horrible. I finally got on my knees, crawled to the bedroom, realized I couldn't move my left foot. It was completely dead. It was numb from my thigh down to my foot. And I'm a physical therapist, so I went, uh-oh. And I thought I've got 2 options. I can go to the doctor and get anti-inflammatories. I can just take ibuprofen and do it myself. Or I can go to a surgeon and say, okay, is this bad enough? And I knew enough to think, okay, well, the nerve is not conducting right now. Let's see what it does in a couple of weeks. And it started to get a little bit better after a couple of weeks. I started to be able to move my toes, so the inflammation was getting off the nerve. But over 3 to 4 years, I kind of ignored the symptoms and I let them be bad. I let myself hurt. I'd go out and play paintball or racquetball on the weekend, and I would come to the clinic the next day like this, going, okay, I'm going to treat you. And it was terrible. I mean, and I was, finally, Stacy and I needed intense fellowship. And she said, you've got to do something about this. And I thought to myself, what can I do? First she said, you've got to stop doing things that hurt you. And at that point, I had hurt myself the day before by picking up a pencil. I'm like, stop doing what? Stop breathing? What am I supposed to do? Everything hurts me now. And she's like, well, you've got to do something about it. I'm thinking, okay, you're a physical therapist. You treat patients all the time. Do something to yourself. What are you going to do? Are you going to sit back and go, there's nothing that can be done, and then go treat a bunch of patients and say, well, I can help you. Well, come on. You've got to do something. So I started to be really diligent about some core strengthening exercises. It's very specific things that I can, if you come to see me, we can talk about those things. But very specific things that got my multifidus firing, got the muscles around my spine firing. In about 4 months, I got to the place when I was doing a lot of exercise. I was doing probably 1.5 hours to 2 hours every single day, at least 5 days a week, of real specific back exercises. And after that 4 months or 5 months of time, I literally had no back pain for the first time in 7 or 8 years. Had no back pain for about 6 months or so. And then I stopped doing the exercises, and now I have back pain occasionally, but I didn't want to do 2 hours of strengthening every day for the rest of my life. But if you get your back strong, it will take care of a lot of the pain, a lot of the inflammation, a lot of the triggers of the pain. Okay. All right, I'm going to move on. How much time do I have?
7 minutes.
Perfect. Okay, we're going to talk very quickly about incontinence, and then we'll go some more questions. I want to talk a little bit, because that's another common problem that goes untreated in women, because nobody talks about it. You talk about it with your mom or your grandma, and they say, oh, that's normal, honey. It's okay. It's not normal to leak when you sneeze, okay? That's not normal. There are 4 types of incontinence. Your urine flow is controlled by 2 sphincters. There's a sphincter around your urethra at the end, and there's a sphincter up higher that's part of your pelvic floor. It's called your pubococcygeus muscle. Doesn't matter. I'm not going to quiz you later. This is my wife going, don't talk about that. But there's 4 types. There's stress incontinence. That's the I sneeze or I lift something heavy and I leak a little bit. That's very common because you damage your pelvic floor muscles. If you've had a vaginal birth, you probably damaged your pelvic floor muscles, you think? I mean, they spread out to that big. I mean, my God. I've watched 3 kids being born. It's crazy. Then you have the urge incontinence. It's also called an overactive bladder. Anybody ever heard of that? Okay, you have to pee all the time. And when you go, you piddle a little bit, and then it's like, okay, that wasn't, I really thought I had to go, and I really didn't go. And that's because the bladder muscles themselves have had a little neural damage. There's some neural damage around the muscles, and the bladder isn't emptying fully when you have to go. And so therefore you're getting this full bladder, it only empties part way, and then 2 minutes later you gotta go to the bathroom again. That's also something that can be trained better. And I'm not the one to train it, there are specialists in that though. Overflow incontinence, that's more common in men. Prostate enlargement, things like that. That happens when you don't empty properly because there's a blockage of the urethra itself. It doesn't allow it to flow. It's not the bladder that's not working, there's a block in the urethra and it's not letting the urine come out. And then functional incontinence, which hopefully none of you have unless you have really severe back pain, which is I have to go to the bathroom and I know I have to go and I can hold it, but I can't get to the bathroom in time. I have arthritis or I have back pain or something, I can't actually get to the bathroom and I don't get there in time. So treatment for that, I mean, you've heard of Kegel exercise, anybody heard of Kegel exercise? Okay. So some of you have not heard of Kegel exercises. Kegel exercises are simply, if you're sitting on the toilet and you try to stop your urine flow, okay, you contract those muscles, that's a Kegel, that's what that is. And fundamentally, that's the muscle that can be part of that, especially if you have stress incontinence. And that's typically the kind that you guys are going to find in postpartum with stress incontinence. It's the kind that you damage the pelvic floor muscles and they're not working. So it's just like any other muscle, you got to exercise it. You keep working it and it'll get stronger. The nice thing about Kegels is you can do them anywhere. However, Kegels are not the only thing that needs to be done. So if you're doing Kegels and you feel like you're strong in the pelvic floor and you still have incontinence, that's another thing that therapy can help you with. Now, excuse me, there are people specialized in women's health, and that's a huge, huge help to people. There's every clinic has a women's health specialist, therapist here in Smoky Point. We have one in Mount Vernon at the Skagit Regional Clinics. And you have those issues, talk to your doctor about it. They should be able to send you to somebody that can help you. It's a big deal, and it isn't a situation that is going to get better in time typically. You usually have to do something about it if it's something that lasts more than a couple of months. Okay? Okay, that was my wonderful talk on that.
Why don't you just give some basic things that we as moms, most of us at-home moms, could do on a daily basis if we don't have the capability to see you or something.
Great. Well, first of all, how you do things is probably more important than what you do. When you're lifting your kid and you do this, okay, and then you're vacuuming at the same time. Maybe not the best plan. So when you lift, to lift properly, you don't want to lift with your back flexed in this position and your legs straight, even though that might be the most comfortable thing to do that. You guys are relatively flexible. I'm not. I never get to the floor. This is as far as I know. You want to bend your knees. You want to use your legs to squat, keep your back flat. So as you're lifting your kid in the car carrier, you're walking out like this, that's a bad idea. Have it in front of you. Your center of mass is right here. You want anything you lift as close to your center of mass as possible. That's going to help you quite a bit. So if I'm lifting the chair, without the microphone, I want to be here, have it into my body, and stand up. It's pretty simple. There you go. That's going to prevent back pain and injury probably better than anything that you can do. Now, as far as strengthening, things are like simple things, like tightening in your tummy while you're sitting there, working on those muscles in your back. If you tighten your tummy enough, the muscles in the back should contract. If you just tighten your tummy and the muscles don't contract, you've got a disconnect between the two, and you probably do need to see me for a visit to get things going. But if you can't, then just get it so they can contract. And then when you stand, you simply do some squats with those muscles tight. Tighten those muscles every time you transfer, every time you roll over or stand up or sit down. That's a good thing to get those muscles going all the time. Be conscious about it. Because normally your daily work, if you are conscious about how you move, is probably enough exercise to get pretty good strength if you just move around. And you can always do other things too, planking and other things like that. But I mean, I think basic things like that are the most important things that will prevent injury for you. Other questions?
Last one.
Okay, last one.
How long after you hurt your back can you do something about it?
Forever. I've treated patients that have had pain for 25 years, and they've gotten better in 3 weeks. They were pretty mad. Depending depending on the cause of the pain.
And I'm a CNA and I hurt my back when I worked at Josephine's and they just made me keep working, so.
Yep. Teach you, to change how you move is probably going to be the biggest thing.
Oh, I was lifting with my knees.
And
Just a
then-
really fat person.
The second thing, yeah, it's just a really big guy, yeah, or gal, yeah. And then the other thing is, once you damage the tissue, how to get it so it's stable. That's what we have to do with you, is make sure we stabilize it. Yeah. Okay.
I just want to tell you guys, he has been gifted by God. Seriously, they were going to take out the disc and put screws in my back. But I have to say that he's not a God. But we have to be diligent because when I don't do my exercises, don't strengthen my muscles, the pain goes right back down my legs and I can't watch it. But, and so really, I'm just saying, pray about it, but if you're in pain, then you don't have to be. Unless it's like severed or something.
I'm not a miracle worker, but I know one.
All right.
All right, thanks, guys.
Awesome. Thank you.